Welcome everyone to Tech Spotlight at SAWC. I'm really pleased to be here with my longtime friend and person I've known in the wound care space for a long time. He's the CEO of a company called eKare. And Patrick and I go way back, Patrick. I remember when I was working in Georgetown in Washington, D.C., and Patrick didn't even have a company at that point. Now they're a major player, especially in the generative AI piece. But I want to talk before that. Tell us a little bit about your company and the growth and what your expectations were when you started.
Thank you for inviting me, and it's always a pleasure speaking to Dr. King, and we always learn a lot from you and get a lot of inspiration as well. Yeah, I still remember when we first started, we go to your office asking for advice. I think we really followed it through and try to build a system to help physicians, more than just imaging, to do a lot more. I think over the past 7-8 years, we laid the foundation to have a platform in place that enable us to, I guess, take it to the next step, which is our namesake, insight, right? Get the insight from the data, apply AI to it.
Yeah.
That's our
so
future.
eKare, how did you come up with that name, the name for your company?
We are quite ambitious initially. We started with wound care, but we really wanted to build a little bit more bigger digital health companies. So we wanted to have a name that's probably a little more
nebulous,
universal, not specific to wound care.
Well, let's talk a little bit about the development and evolution of your company. I think you started in the wound imaging space, is that right?
Yes.
And so tell us about that technology and how it's used today.
Yes. Initially, we were trying to target the challenge in terms of how to get the measurement right. I think till this date, the rule of thumb, I guess the gold standard is, in terms of measuring healing, is still the size change, right? And also some of the, I guess, tissue types. That's initially what we did, applying computer vision and AI, trying to analyze those things. We started with a specialized high-end sensor, but now we moved away just using the Apple iPhones because it's getting very powerful. So we get the measurement piece right, and we have been very successful in terms of in the clinical research space where the measurement is quite important. And we have also been expanding beyond just imaging to get clinical documentation. So we're getting a lot of also usage in the clinical side of things. And
one of the things, Patrick, you kind of alluded to is obviously the image capture is important.
Yes.
But there's another dimension that people maybe don't think too much about, but that's really the power of your system, which is the analytics.
Yes.
Can you talk a little bit more about that?
Sure. So initially, the kind of imaging was kind of the selling piece for us to attract some attention, but really does not create value itself, right? So as we go into the clinical practice side of things, we understand we have to add more value. We actually was able to, for instance, we were able to implement the system in a kind of bigger settings. From the data we saw, we were able to, for instance, demonstrate significant saving in terms of better reach to patients. So for some of the specialists, they can manage bigger populations with their limited time and bandwidth, which is an issue across the globe. We have this issue here, staffing shortage. We have the same staffing shortage in UK. This is specifically a UK study. And they were able to show, for instance, 60% of the people are using antimicrobial dressings. They don't have any signs of symptoms of infection. So there's a lot of potential savings in terms of product utilization. And they were able to see that, for instance, some of the patients, they were utilizing the healthcare system a lot of resources, but they don't necessarily need to. They're visiting them every day, don't need to. They can use this technology to monitoring them remotely, just checking in once in a while. So all in all, there's like 5 times in terms of X savings.
So I think that's really important, and just for clarity, because I know that not everybody is as smart as you are, Patrick. So I'm going to dumb it down for myself and others. So what you're talking about is it's not just about image capture, doing the accuracy, the billing, and all that stuff, but it's about big databases, and that's kind of the next thing we want to talk about. And you're kind of diving into this already, is analyzing, and this is the part that's been very elusive for many people, is analyzing things that work, that don't work, that are
Yeah.
overused, underutilized.
Yes. Uh-huh.
And you can only do that by really machine learning and heavy computation.
Yeah, yeah.
And that's where we start talking about treading that line of generative AI.
Yeah, yeah, yeah.
And so let's talk about that. I know that's been a dream of yours. That's something you guys
Yes.
think about. And you guys, I remember having conversations in the mid 2015s, 2016, where you're talking about generative AI. And I looked at you with a blank stare, like, I don't know what you're talking about. But now it's 2024 and it is everywhere.
Yeah.
It's happening in lots of
Yeah, yeah,
sectors.
yeah,
Healthcare is probably the most underutilized sector of generative AI. It's in filmmaking, it's in music,
Yeah, yeah.
it's in social media and everything else, but in the most important space,
Yeah.
which is our daily health,
Yeah.
it's not been fully utilized.
Yeah.
So tell me, one, why that is, why you think that barrier
Okay.
exists. And secondly, how your company is addressing that.
Okay. Yeah, I think it's just amazing. When I started as a graduate student in engineering school, we were doing neural networks already, applying to image analysis. So that was actually kind of precursor to all these kind of more complicated transformer model. But I think just in the last year, this whole improvements in terms of computational power and the large data sets we're able to consume really create a model. They call it kind of emergence. So to develop some capabilities we did not anticipate. Initially was developing it for like finishing the sentence kind of tasks, but now you can see that it's doing some pretty impressive work.
Yeah.
So we look at this, we were really excited when we saw these announcements. We jumped right on it. Starting from our company itself, we are really leveraging these. So for instance, we have some really smart developers was able to do usually what usually takes full-person job, like a front-end, back-end, database, kind of full stack, right? He was able to use AI himself, prototyping our first generative AI solution within like a month.
So I want to just repeat that. So the machine was teaching the machine on how to do the job. Is that right?
No, he's just using the AI. For instance, I wanted to create a server. Could you show me how to do it?
Right.
It's generating the code for him. He just runs it. Of course, you have to have some background in the AI space, in the programming space, to really using it, right? So we're using it through and through in our company. So the productivity boost is amazing. Going back to healthcare, I think healthcare is going to be the space getting the most benefit out of this AI, because this AI is very good at consuming a large amount of data and also very good at handling some of the mundane tasks in healthcare. I think you guys spend 30% of your time doing administrative work, right? There's a lot of compliance-related stuff, a lot of documentation-related stuff. I think those perfect tasks for AI. I think the reason why AI hasn't really been picked up in the healthcare space, I think there's a lot of excitement already. People started to playing with it. The reason is there's still some limitation. One, I think the biggest challenge is regulatory approval. So depending on what your claim is, you want to use AI for decision making, that's a higher bar to cross, right? But I think there's lower hanging fruits for us to do. Like for instance, education, you will make medical education a lot more enjoyable.
Right.
You can do double checking some of the administrative work. It would be perfect, right? So I think those are the low-hanging fruit. I will see more adoption quickly. And the other reason for the slow adoption is healthcare is so complex, right? People sometimes don't understand the scale of the complexity of the healthcare system. For we have been in this space so long, we're always learning every day, but if you think about it, it's like $4-5 trillion industry. That's almost bigger than Japan or Germany's GDP. So trying to apply it across the board, I think it'll be difficult. This complexity of the system we have. I think the last piece is really the also variance. For instance, every institution practicing medicine differently, especially in wound care space, there's really lack of standards based on our experience. So we were fortunate enough to have a little bit kind of a global perspective. We work with different markets, so we always run into these challenges. We cannot build a kind of a decision support system based on the US practice and transfer it to other markets.
To Europe or somewhere
For
else.
instance,
Yep.
no other market is using tissue products, using hyperbaric oxygen therapy, using all these things. So a lot of this data here probably doesn't really apply to other places. And that also means if you can actually train your AI based on your own data that fits your own need, that will be the future. That's what we're working on.
So I think you make a great point, Patrick. One of the things that the technological challenges is to be local. On the local level.
Tailored.
So, for example, where I work, it's different from where I work versus 1 mile away at a different hospital. They may have the same EMRs, perhaps the patient mix is different, populations are different, their problems are different, and so the customizability that AI is needed for each individual, I think, is the biggest challenge, because people think that, oh, you put machine learn everything, get the biggest database. And I don't think that's the right approach either.
Yeah, I don't think, that's the challenge, right? When you look at, even though whatever Matt Palm developed at Google can pass the medical exam 70%, but that's all generic stuff. When it gets to the nitty-gritty, how you practice medicine, there's a lot of nuances. Different organizations have their own systems.
People talk about the complexity of generative AI, and when I talk about it in terms of healthcare, I'm like, well, there's no other more complex system than the human being.
Yes.
That is the most complex system you'll ever encounter. So as smart as generative AI will be, you're still dealing with another system that's more complex, which is the human person.
That's millions years of evolution.
That's absolutely. And we don't always do everything right, but and we're prone to failure and injury. But I think that's one piece that I think people are like, oh, it's all data, it's all data driven, big data, that's all we need. I'm like, no, it's very individualized too. That's the nuance and the trick, I think, is the challenge for companies like yourselves. In the last couple of minutes, Patrick, I just want to talk about where you see the future of your company specifically, not the tech space, just your company.
We wanted to build a system that everybody can use, that can add value to people, be an enabler to help people get through their daily job quicker, faster, and at the same time, generating the data that could help the next generation healthcare providers, especially in the wound care space, to do a better job in terms of treating the patient, getting a better outcome, right? So that's our specialization. So we are working on, of course, continue to developing these systems. There's a lot more than technology we need to do to get to that point. Workflow is a big deal. We have to, make sure this is, easy for people to use, part of the workflow, and we have to make sure we can integrate with the system, right? Existing EMR system, getting the data flow. And I think last piece is we wanted to, medicine is a multi-model practice. You're looking at patient, you're smelling it, you're trying to do a lot of things. I remember the experience with you, at one time you actually really have to smell the wound to kind of detect some of these potential infections. So there's more than just text data, there's image data, there's other things. We're working on bringing all those data into one platform. And then I think the next step is really applying the AI to make sense out of the data, to really help,
Perfect. Well, I want to thank you, Patrick, for joining us on this Tech Spotlight. I would encourage the viewers to go on their website for further information. Thank you very much.